All right, I think we'll get started. I'd like to welcome you all to our every other week press conference, our COVID press conference. We'll surely got a esteemed panel today. I'm flanked by our experts in the community. We've got really a lot to talk about today. Dr. Bill Remington and Teresa Reed are here from the Kosciuszko County Health Department. Will be giving us their updates. Kirk Carlson from Bowen Center has got some good information for us, and we'll get to him here in a minute. I wanted to start and just talk a little bit, just a couple things. First of all, there's been a lot of question about Halloween and trick-or-treating, and tentatively, and I underline tentatively, the city and in our partnership with Town of Winona Lake, we've discussed with the health department that we will tentatively be having trick-or-treating on Saturday, October 31st from 5:30 to 7:30. And that's just kind of our usual announcement that we have every year, COVID or not. We like to set our times and date, and that's really what I'm doing right now. Again, Saturday, October 31st from 5:30 to 7:30. We will certainly be looking at and following our numbers that you'll hear maybe a little bit more about today. We are also going to come out with some guidelines and recommendations as we get closer to Halloween with safe practices and certainly things we'd like to see folks do if they want to participate. But at this point, I'll just say that at this point, the city of Warsaw and Town of Winona Lake are still planning trick-or-treating on the aforementioned dates and times. So there'll be more to come on that. The second thing is, I know I talked last meeting about potential permanent testing site in our community, and by permanent I mean through the end of June. The State Department of Health has extended an offer to support that type of testing, so you'll hear more about that today. You'll hear some more details about that, which we're excited about. In the meantime, our testing at MedStat and Parkview will continue. Our CARES Act testing will continue, although as this clinic gets up and running, we will be transitioning to all of our CARES Act testing being performed through this state site. So more to come on that, but for now, testing is still available at Parkview and MedStat. Third thing I'd mentioned, I think last week as well, the Indiana State Department of Health is looking at surveillance testing, and they will be actually in our community, but this is a by invitation only. So you may see a site set up down at Central Park, but it's a random sample of the population. Those folks have received invitations and have registered, and they're the only ones that will be tested. I believe they're tested for COVID and for antibodies as well. So please don't confuse that site. If you see Friday and Saturday that site available, it's just for the Fairbanks study, surveillance testing by invitation only. What I might add is if you are local and you have received an invitation to participate, please register. I believe that's an important part of them getting through those 2 days of testing. So again, Fairbanks testing down at Central Park by invitation only. And with that said, I believe I have exhausted what I need to say, and I will ask Dr. Remington to provide an update from the health department, and I'm sure Teresa as well. So ladies and gentlemen, take over.
Sure. Well, let me give you the bird's eye view, and Teresa will be more specific. Our case count is fairly steady. We're up over 1,200 cases now in Kosciuszko County. We had a community event in the last week that was a spreading event. Many participants of that social event are COVID positive or suspected to be COVID. Not to point fingers at the event or the organizer of that event, but just to say it still happens. It's still around. It's a contagious virus, and it sometimes just doesn't take much in indoor congregate settings. So please be wary of that, particularly the indoor congregate settings. Wear a mask, social distancing, frequent hand washing as best as you can. Those are still good things to say. As we back up and look at the broader view, I was listening to the State Department of Health's webcast from their chief medical officer on Friday, and I heard this: the counts are steady. They just are. And that's disappointing in itself, isn't it? I mean, it just isn't going away. There's a hot spot in southwestern Indiana, Evansville area that they're particularly watching. We are not a hot spot, at least as of last week's data analysis. Whether this cluster of cases will make us more of a hot spot, perhaps. Our positivity rate has come down as we've worked on some nuances with reporting the negative testing of the point-of-care testing that is so prevalent these days. That's a tough thing to ask busy clinicians to do, but we're getting that data now. It's cumbersome, it's not so automated, but thanks to all those working on that. And thus, the positivity rate is going down. Our color is now blue on the state's dashboard. So many eyes are on that color map from after the governor's press release a couple of weeks ago, putting eyes on that. So it was important for us to have correct data represented there so that the community was not too anxious about where we were from a positivity rate. So we're cleaning up that data, and we're looking okay. But it has not gone away, as this recent spreading event illustrates. We talked about case fatality rate a little bit last week, and I wanted to just review in my head here what the CDC has demonstrated as far as mortality. And as you've heard, it's a bit of a slide bar. It depends on where you are on the spectrum of age primarily. And this is just a simple download from the CDC's site. Any of you can look at that. If you are 85 and older, your death of COVID is 630 times the average. Okay, so that's at the extreme right end. If you're 0 to 4 years old, you're 9 times lower. So it's kind of a slide bar, isn't it? So age is the strongest demographic risk, and thus our nursing homes. We've heard those mortality statistics from the nursing homes, and we are going to be extremely protective as a public health strategy toward nursing homes for quite some time. Perhaps in the general population, slowly we'll ease out of 14-day quarantine to maybe a 7-day quarantine. Stay tuned for that. I think it may be coming in the not too distant future. But for right now, those close contacts not ill, it's still a 14-day quarantine. Mortality data is interesting. Again, looking at a little different graphic on the CDC site. If you look back historically, week by week during this pandemic, you can see that we really are heading in a better direction nationwide. April was horrible. And even though there's been pop-ups, June and July, a bit of a surge, they're coming down again as far as the absolute numbers. Now, in all honesty, there is a lag in that indicator, so that mortality data takes a while, and the deaths that occurred perhaps even, or the infections that led to death from 2 months ago are just now being reported. So it is a lagging indicator. But even having said that, I see an improvement in the mortality aggregate for this nation since April, for sure, and since June and July. Condolences, again, to those in our community who have lost a loved one to COVID. Please be a good citizen, wear a mask for others, be gracious that way, and we just need to keep our head on here longer. I wish this was going away, but it's not. So we don't have an explosion. Teresa, I'm sure, will talk about this recent event with a few cases. And schools, fortunately, are not an explosion of cases. Again, I'll let Teresa talk about that more specifically. So, thank you.
All right, with that, Teresa?
Okay, one of the things I just wanted to bring up is that the unpredictability is, again, the word of the week. As we watch, there's just been this recent uptick that may be due to the social event. I'm not quite sure if that's all of it right now or if there's more going on. So we did add a little disclaimer to our school report that you have the paper version, your electronic version will have the cautionary tale on the front. Those were printed before we got to that. But we just want you to remember those things, please. Take precautions, social distancing. If you're not feeling well, stay home. Stay home. If you're not sure if you have a cold or allergies, you may start a blossom of COVID by attending the activity. I know it's disappointing, but it's disappointing. And when if you attend school and you have symptoms, you take out a lot of your classmates. It's just a hardship. The same for us adults. You know, you cause illness, you cause cascades of illness that may not be serious for you, but it may be serious for others that will eventually come from that cascade. So please be cautious. But yes, the school report, I'm pretty pleased with it. I wanted to say how we get the school report because these numbers are a little different, a little special. These numbers come with information moving both directions. The school, if they find out about a case, they call it to us immediately and we start that casework from the school's information. If we monitor the reports from the state, the NBS, the database during the day, and faxes and phone calls. And if we get the information on the student first, then we reach out to the school based on a guesstimation by address to find out what school that child attends. That's in the tax records. It's not too hard to find. So that's where this data comes from. These are all the cases that we're working with the schools. So 44 cases as of the 28th, with 298 individuals quarantined by the Kosciuszko County Health Department. Those people do get an email and things so that they have that information. Last week, the total cases in Kosciuszko County was 60. The cautionary tale this week is because yesterday we had 31 cases reported. So more than half of last week's cases were reported yesterday. And there was a minor trend up before that. On the 27th, there was 11 cases, which was a little higher than it trended last week, and 12 cases on the 28th. So we have a little uptick. I'm just not quite sure why yet. Luckily, especially in our school kids, in reference to the graphs, most of them have a very mild illness that lasts less than 4 days, so we're very thankful for that. We're going to keep watching that since that impacts where we think the lines are on whether or not we can do things like hold a Halloween festival, a trick-or-treat. Those things are, if it's safer, if we give people a cold, we don't want to cause illness, but we're going to remember that as we balance the risk and where those risks lie also to the children in their education. So we did add a new data point on the symptoms of the school-related cases because since this is our data in our county, the school nurses said, hey, some of these kids are fatigued a lot longer than I would expect. And so that's our new data point at the end of the graph. It's extended fatigue, and that lasts longer than 2 weeks. So we're watching because obviously the latest cases we haven't been able to evaluate for that because they haven't had 2 weeks and this is too fresh. So that's a moving data point. Timing of the cases. At the end of the September calendar, I'm a little, last week there was cases reported every day, not too many cases, but there were cases every day. This week we have had, 3 cases on Monday and then 2 cases involving schools yesterday, and there was 1 case this morning involving schools. So that's our caution. That's why we're really pushing. Please remember, let's keep doing what we know is working. Let's keep those things so that we can keep other things working. So the remainder of the graphs are just pulled from NBS data directly to look at different metrics in a way here. So that's everything. The antigen tests, I will address that because it plays into part of our successfulness in schools at keeping transmission low there. it's sometimes heart-wrenching because we'll have someone who went to school well in the morning, and by the afternoon we have a positive antigen test, and we are pulling students out of school the same day as they were exposed. Obviously, that doesn't happen all the time, but when that testing is available, that's the kind of efficiency that the Kosciuszko County Schools and the health department's trying to maintain for our community.
All right, thank you. The Kosciuszko County Health Department has done a marvelous job with information, and I think the information that you've just shared is testimony to that. There was an article in the Journal-Gazette last Friday that really talked about how transparent and how in-depth our health department has been, especially through the school issues. So my hat's off to you all for getting the information out. It's vital public health data that I think shapes and forms people's opinions, if you will, of what they should be doing, and having this information out, and it's in black and white, and well, even color. But you've done a marvelous job with that, and it's been recognized as somewhat leading in the region, that transparency of data. So I certainly appreciate that, and I know that probably at the end of the day makes everybody's job easier. So thank you, appreciate that. So I got Kurt Carlson here from as director at Bowen Center, and he's got some exciting news about our new testing site. So Kurt, you're on.
Thank you, Mayor. As some of you may know, Bowen Center recently opened a primary care clinic, the Bowen Health Clinic, there at the intersection of Providence and Du Bois, right across from Pillbox Pharmacy. I think when that came to Bob Weaver's attention, he reached out to me and asked if Bowen Center would consider, on behalf of the health department, to be put together a testing site. Said yes, met with him, looked at the material, met with Dr. Remington, understood better what is expected from the state. Put a work plan together, submitted that to Bob. He submitted it to the state, and yesterday I was informed that the state has approved that, and now it's going on to the next phase at the state. So we've already started to recruit staff to do the testing, work at the testing site, having a construction trailer brought in, etc., starting to work on the material for advertising. We have to wait until we get the training material from the state. They also supply laptop and printers for the labels of the sampling material, all the sampling material itself. So there's still a number of things we have to get from the state before we can actually start doing the testing. It will be on Du Bois Street, again, in the parking lot of the new health clinic, across from Pillbox Pharmacy. There will be an entry ramp, and then there'll be an exit from there so that traffic can flow. It will be a drive-through site. The hour, and we'll have staff there. We won't be open on Sunday or Monday, but the state likes Saturdays and evenings. And so we'll be opening up mid-morning to late morning, Tuesday through Saturday, and then stay open Tuesday, Wednesday, Thursday, and Friday in the evening hours for the convenience of persons who need to get their testing done at that time. We will continue this through June. And if the state extends the request for a testing site beyond that, we will continue it. Bob and I have talked about a second site because Kosciuszko County qualifies for 2 sites. And what we discussed was a mobile solution for the second site because everybody doesn't live in and near Warsaw. So if that second site becomes feasible, then we would spend some days in Syracuse, Webster, down in Silver Lake, etc., get to the different towns. on a schedule that makes sense for those locations. Again, it is a privilege for us to serve the community. The person I've selected as the director is bilingual, bicultural, Hispanic. All the staff who will do the testing and do the collection of information, because you come, you drive up, you answer a bunch of questions, sign some forms, and then you go on to the next person who actually administers the test. And then we label that and refrigerate it, and at the end of the day, the state has a courier service to come pick up those samples. So there's some details there that have to be worked out. But all the staff employed at this site will also be bilingual, bicultural, Hispanic, because as we know, the Latinx community are very much at risk, and we want to make sure we go that extra step to reach out to them, make it a friendly and welcoming testing experience. I don't know, are there any questions? Dr. Remington, again, I so appreciate the health department reaching out to us and giving us the opportunity to serve the community in yet another way.
Well, it's very encouraging to me personally to see you take the baton so strongly, Kurt, so thank you. And I appreciate Bob Weaver, our administrator at the health department, reaching out to you like he did. That was not my idea, that was his, and I am so thankful he thought of you. And thanks for being a very engaged community player at the Bowen Center. This has really impressed me. And that work plan is very generous with the evening hours and Saturday commitment. And that'll serve our community well. So thank you. That's an exciting development, really. It gives us another venue for testing that is durable, which is what we need. Thank you.
And Kurt, I appreciate as well, as you all are aware, we've been kind of piecing together testing strategies as this whole thing evolves, and different types of testing and locations. And we are, as you know, the county and city have partnered to provide city $100,000 and the county $200,000 towards CARES Act testing. And that was to supplement where we had none previously. With this state clinic being operated through the county health department by the Bowen Center, this basically takes the state CARES Act funds and utilizes those same CARES Act funds, only the state allocation for the testing. So the city and county requirement as this test site is established will not be necessary. When we had state drive-through testing down at Central Park, that was all state CARES Act money, and the city and county did not have to participate and support that. And I think that was the end game from the State Department of Health, is that they wanted, as you suggest, a more durable site, permanent site that, that we could operate locally, but they are fully supporting. I know, looking at the agreement, the state is providing just about everything, and then Kurt is providing the site and the staff to do this, which is the key component to getting this done locally. And I'm again very thankful for what you're doing. But that leads us to the state CARES Act testing, which we will phase out of as this clinic gets started, and there will be more coming to that. So our primary testing site will be this site at Bowen Center as it gets up and running, and we will have no gaps in testing. State, county, and city will still provide testing until this site gets moving. We'll have a little bit of overlap, and then we'll transition to full testing at this Bowen Center site, and more to come on that. But for now, we're continuing, again, as I mentioned earlier, to continue to test at MedStat and Parkview, CARES Act free testing for any of those who need it. So with that, I think it's probably a good time to open up for questions. I know we covered a lot this morning, and I'm sure there might be a few. So.
Which microphone's working? I know you said there's a lot of things to work out as far as is there like an estimated start date, or is it,
We've already started to recruit staff. I've already hired the manager for that. And like I say, moving the trailer in, we have to use the state's laptop and printer and software. So that's really the most crucial thing to have, and of course the sampling material. So it's really dependent on the state. I mean, if they had it for me next week, we'd be ready to go next week. If it's 2 weeks, then it'll be 2 weeks. But it won't be held up by us.
okay. And you said you've already picked a director. Did you want to say their name yet, or?
Yeah, Gamal Hernandez.
Can you spell that?
G-A-M-A-L-H-E-R-N-A-N-D-E-Z, I think. He has been on the mayor's task force for quite a while, and when they did the testing site that weekend at Our Lady of Guadalupe, he actually worked at that site. So he's frankly the only one of our non-medical staff who's ever done any COVID testing. And so he knows what the routine is like. He knows how it's done because he's experienced it.
Okay.
And he will recruit and vet the staff.
And you mentioned, you know, the Latino community and the important to reach out to them. What are the plans to reach out to them to let them know there's this more permanent testing site?
All signage, brochures, everything will be in both English and Spanish. Gamal has a good connection through, what's the name?
Yeah, David, I can answer that. The Northern Indiana Hispanic Health Coalition has been working, they're out of Elkhart County, and they've been working very closely, Liliana Quintero, and we've been meeting probably for 3 months with a group to just look at the cultural needs of all of our communities. And we've been focused on the numbers and focused on getting the information out. And I do believe the word will spread very quickly. Gamal's a marvelous choice to do this. For that reason, I know the state requirement for this testing site was that there be cultural sensitivity to the site, to the procedures, and obviously the interpretation and bilingual support. So I don't see a problem with the information getting out because of the organization that we've got. In fact, I was on with the group yesterday. I wasn't sure I was able to name the site, so I called Kurt and asked him, and not only did he tell me we could name the site, but we could also name Gamal, and they were ecstatic about that. So Gamal will do a great job for all of our communities, different communities within our city and county. So very, very happy about that.
And then I have a question for Dr. Raventon about something. Lately, when I'm talking to other people, the concern of the flu keeps coming back up. And we were discussing whether or not you could have the flu and COVID at the same time and what that would look like if that was possible. Can you talk about the upcoming flu season, and is there a start date, I guess, for it? I mean, I know it's, you know.
So influenza is a seasonal virus, and it typically comes in the Northern Hemisphere significantly after Thanksgiving, and usually wanes by mid-April. Every year's different, can't perfectly predict. Some years start early, some don't get up and running until late February, just all depends. We look to the experience in the Southern Hemisphere that have good public health reporting in recent years to kind of get a heads up for the upcoming season. So like previous years, we looked to Australia specifically here in the last few weeks, and their nod is that it looked to be a mitigated season. It was softer. Perhaps people postulate it's because of the masks and the social distancing and the hand washing because of COVID, but nobody perfectly knows, but it makes intuitive sense to suggest that. So maybe we'll have a softer experience for influenza in the Northern Hemisphere in a couple months. Nobody knows. Last year, they were correct. They said, look out, here it comes, and they were correct. So how, if I wear my clinician hat, I don't know that I could sort out a patient bearing both COVID and influenza. They both are very similar clinical presentations, right? Fever, you feel gross, achy, run down, headache, horrible fatigue. Maybe the distinguishing novelty with COVID is the loss of taste and smell, specifically. Both can compromise you. So morbidity and mortality data, just now wearing my public health hat, is going to be tricky. Not that that's our primacy, but again, wearing my public health hat, it's going to be tricky to sort out what's what in the months to come. The discussion of co-infection was around this past March and April. You know, we saw waning influenza A, H1N1 of the 2009 pandemic strain was around in March and early April. And there was commingling. A lot of postulation, can you be co-infected? And the word on the street among the experts was probably. Again, hard to clinically distinguish it. Testing helps you. Realizing there is a false negative issue with tests for both pathogens, both COVID and influenza. The tests we use have a significant false negative rate. So testing doesn't perfectly help you. But get a flu shot, please. Between now and the end of October is a great time. And wear a mask, social distance, wash your hands, be careful of congregate indoor settings such as our recent experience, which can be a transmission source for either pathogen, respiratory droplet transmission. Again, some discussion of aerosolization with COVID specifically, and even that comes up with influenza. Is it aerosol spread or not? That's getting a little technical, but that I read discussions about that pop up every season with influenza, but traditionally it's large droplet transmission, so spatial distance makes a difference between the person coughing, sneezing, or speaking loudly.
All right.
Dr. Carlson, last time you were here, you sort of talked about mental health. Have you seen, since the last time you were here, have you seen any changes, any increases in suicide or depression or anything like that? Or
Well, one of the things, speaking of schools and that point, I just spoke with a school official yesterday being very concerned about the bus drivers. And I talked to another school and they were very concerned about the teachers in the schools where they're doing some remote and some in-person. But then I also heard school teachers tend to be able to talk to each other, give each other mutual support and all that. Bus drivers are all alone, and they tend to be retired persons anyhow. So that was a concern. Again, I don't know if it's exactly your question, but that's something that I probably hadn't thought of. And we have employee assistance programs as well as student assistance programs. So in schools that have the employee assistance program, those employees can seek help and have up to 3 prepaid sessions at no cost to them. And so that particular school system I was talking to, it was Syracuse, they're going to encourage their bus drivers to do that because they're seeing the impact it's having. The other superintendent that I talked to, or principal I talked to, they were concerned about the stress this is putting on the teachers. And I understand that because it's stressing parents, it's stressing kids, it's stressing everyone. So that's a population I'm particularly concerned about now, the school officials and the school employees.
All right. Anyone else? Okay. Well, again, a lot of information today. We'll be back here in 2 weeks on the 14th, and I assume we'll probably have some updated information on the clinic. We'll have some updated information on our local CARES Act testing. We'll probably have some updated information on Halloween. I didn't think we'd need to continue these press conferences, but it seems like they've been helpful, and we've been able to get out information as currently as we can. So, again, for the time being, we'll continue every 2 weeks. And we'll see you back on the 14th. Thank you very much.
Clarifying sometimes things, at least if you're there, that's usually how it works locally.
Thank you for all your
Everyone got one.
coordination.
And then
I
Rosie
should have said that
Gonzalez
publicly,
is
but
just-
oh my goodness, you have just